This is All India Radio. I am Tanvi Taneja and with me is Renuka R.S. with the evening news. The headlines. Prime Minister Narendra Modi addresses the United Nations Economic and Social Council session virtually. Defence Minister Rajnath Singh says armed forces well prepared to protect the country's self-respect and pride. Health Ministry says COVID-19 fatality rate in the country is one of the lowest in the world. Central Board of Direct Taxes issues refunds worth more than 71,000 crore rupees during the pandemic. And PM Swarnidhi app launched to provide micro-credit facility for street vendors at their doorsteps. Prime Minister Narendra Modi delivered the keynote address virtually at this year's high-level segment of the United Nations Economic and Social Council session at the United Nations in New York a short while ago. The theme for this year's high-level segment is Multilateralism after COVID-19. What kind of UN do we need at the 75th anniversary? India has expressed concern over the recent reports of exchange of fire on Armenia-Azerbaijan border, saying that the situation threatens regional peace and security. India has urged both the sides to maintain restraint and take all possible steps to maintain peace at the border. In response to media queries regarding the situation, External Affairs Ministry spokesman Anurag Srivastav said, India believes that any lasting resolution of the conflict can only be achieved peacefully through diplomatic negotiations. He said New Delhi supports Organisation for Security and Cooperation in Europe, OSCE Minsk Group's continued efforts for a peaceful resolution of the conflict between Armenia and Azerbaijan. External Affairs Minister Dr. S. Jaishankar has countered former Congress President Rahul Gandhi's questioning of government's foreign policy. He said India's major partnerships are stronger and international standing higher. The minister added that the country has witnessed regular summits and informal meetings with the US, Russia, Europe and Japan. Dr. Jaishankar said India engages with China on more equal terms politically. The minister highlighted the achievements in Afghanistan, saying the projects related to Salma Dam and Parliament have been completed and training and serious connectivity have been expanded. Taking a dig at Mr. Gandhi for not mentioning Pakistan, Dr. Jaishankar said the neighbouring country surely notes the difference between Balakot and Uri on one hand and Sharm el-Sheikh, Havana and 2611 on the other. Earlier, in a video, Rahul Gandhi had said that over the last 6 years, India has been disturbed and disrupted with regard to its foreign policy and economy.
The Central Board of Direct Taxes, CBDT, has issued refunds worth 71,229 crore rupees in more than 21 lakh cases to help taxpayers with liquidity during the pandemic. CBDT said that income tax refunds amounting to 24,603 crore rupees have been issued in over 19 lakh cases to taxpayers and corporate tax refunds amounting to 46,626 crore to taxpayers during COVID days. It said the government has laid great emphasis on providing tax-related services to the taxpayers without any hassles. CBDT further said that all the refund related to cleaning up of the tax demands are being taken up on priority and will be completed by 31st August of this year. Finance Minister Nirmala Sitharaman today said that the public sector banks have sanctioned loans worth 19,669 crores till 15th of July this year. She said the loans were sanctioned for 71 MSME hubs in 27 states and UTs under the 100% Emergency Credit Line Guarantee Scheme, ECLGS. The minister informed that 12,871 crore rupees have already been disbursed. Under the Atmanirbhar Bharat Abhiyan, the government announced collateral-free loans worth 3 lakh crore rupees for MSMEs with turnover of up to 100 crore rupees till 31st of October this year. A total of 45 lakh MSMEs are expected to benefit from the scheme. The National Pension Scheme NPS subscriber base has registered a growth of 30% in the first quarter of this financial year. The Finance Ministry said 103,000 individual subscribers are from the private sector and 206 corporates were enrolled during the first quarter, resulting in a total of over 10 lakh corporate subscribers. After the onset of COVID-19, employers have adopted deeper measures to ensure adequate support to employees in terms of their financial well-being. Chairman of Pension Fund Regulatory and Development Authority, Supratim Bandyopadhyay, said the NPS scheme has been a success amongst the corporate employees.
Defence Minister Rajnath Singh visited forward posts in eastern Ladakh region today. This is the Defence Minister's first visit after the standoff between India and China in the region. At Lukung on the banks of Pang Song So, Rajnath Singh addressed the troops. The Defence Minister said India has given the message of peace to the world. He said, "We believe the world is one family, but if our pride is attacked, we will not tolerate it."
आप जैसे सेना के जवानों को जिन माँ बाप ने पैदा किया है, सचमुच में शीश झुकाकर उन माँ बाप का भी हार्दिक अभिनंदन करता हूँ। हाल में जो कुछ भी हुआ है भारत और चीन के सेना के जवानों के बीच, मैं कह सकता हूँ कि आप लोगों ने केवल भारत की सीमा की सुरक्षा नहीं की है, बल्कि 130 करोड़ भारतवासियों के सम्मान की सुरक्षा की है। इसके लिए भी मैं अपनी तरफ से आप सबका हार्दिक अभिनंदन करना चाहता हूँ। कैसी स्वाभिमान की भावना आप सबके अंदर है। क्या आप सब कुछ बर्दाश्त कर सकते हैं, लेकिन अपने स्वाभिमान पर किसी भी सूरत में चोट नहीं बर्दाश्त कर सकते।
He praised them for not only defending the country's borders but also the pride of 130 crore Indians.
भारत दुनिया का इकलौता देश है जिसने कि दुनिया के किसी देश पर न तो कभी आक्रमण किया है और न दुनिया के किसी देश की 1 इंच जमीन पर कभी कब्जा किया है। वसुधैव कुटुंबकम का संदेश सारे विश्व को किसी एक देश ने दिया है तो हमारे और आपके देश भारत ने दिया। हम अशांति नहीं चाहते। हमारा चरित्र रहा है कि हमने दुनिया के किसी भी देश के स्वाभिमान पर चोट पहुंचाने की कभी कोशिश नहीं की। लेकिन यह भी मैं कह देना चाहता हूं 2 टूक शब्दों में, यदि कोई दुनिया की ताकत हमारे स्वाभिमान पर चोट पहुंचाने की कोशिश करेगी तो उसे किसी भी सूरत में हम बर्दाश्त नहीं करेंगे। उसका हम मुंहतोड़ जवाब देने के लिए भी तैयार रहेंगे।
A report from our correspondent.
Defence Minister Rajnath Singh completed whirlwind visit to Leh and forward posts in eastern Ladakh region. When the Finger 4 of Pangong So and Depsang plains were in focus in talks between the commanders, Defence Minister visit is seen as a key development. Corps commanders level talks focused on disengagement of PLA from Pangong So and Depsang plains. Defence Minister visiting the ground zero to see the situation and review this disengagement process at the friction point sends a message of the intent. At Lukung post, the Defence Minister addressed the troops and interacted with the forces. Before Lukung visit, the Defence Minister witnessed the demonstration of coordination between Indian Army and Air Force at Tikse Rambirpur in Leh. Minister, along with the Chief of Defence Staff General Bipin Rawat, Chief of Army Staff General M.M. Narwane and Northern Command Lieutenant General Y.K. Joshi, along with the senior Army officials of Fire and Fury, were present at the demonstration. Ramesh Chandra, All India Radio News, Leh.
Health Minister Dr. Harsh Vardhan has said that India is on track to achieve the maternal mortality ratio MMR targets for Sustainable Development Goals and the National Health Policy. Speaking on the success achieved by India on the maternal mortality ratio, Dr. Harsh Vardhan said MMR of India has declined by 9 points in 1 year as per the special bulletin released by the Registrar General of India. The ratio has declined from 122 in 2015-17 to 113 in 2016-18. Dr. Harsh Vardhan congratulated the state of Rajasthan, which has shown the maximum decline of 22 points, Uttar Pradesh 19 points, Odisha 18 points, Bihar 16 and Madhya Pradesh 15 points. He also stated that the 2 states, Telangana and Maharashtra, have shown more than 15% decline in MMR, while 4 states of Odisha, Rajasthan, Andhra Pradesh and Gujarat have shown a decline between 10 to 15%.
The government today said that the actual caseload of COVID-19 in the country is only around 3,42,000. The Union Health Ministry said more than 6,35,000 of the total cases have recovered. It said that less than 1.94% of the cases are in ICUs, 0.35% cases are on the ventilators, and 2.81% cases are on oxygen beds. The ministry said the case fatality rate at 18.6 deaths per million of the country is one of the lowest in the world. The collaborative efforts of all states and union territories has resulted in early identification of the infected persons. The ministry said India has followed a standard care protocol for the differentiated categorization of COVID-19 patients, mild, moderate and severe. The effective clinical management strategies have shown to yield positive results. The ministry said there are 1,383 dedicated COVID hospitals. The Union government has informed that there are sufficient stock of over 15,000 metric tons of medical oxygen supply and there is no problem in manufacturing, storage, transport and supply of medical oxygen. The Commerce and Industry Minister Piyush Goyal today reviewed the situation of medical oxygen supply in the country. Average monthly consumption of medical oxygen has gone up to 1,512 metric tons per day, which was 902 metric tons per day in April this year. The government said appropriate arrangements have been made for providing medical oxygen at remote areas. It was highlighted that the percentage of COVID patients who are on oxygen has declined to 4.58% yesterday.
Minister of State in the Prime Minister's office, Dr. Jitendra Singh, today said that diabetes need strict sugar control during COVID pandemic. Addressing a digital symposium of Hello Diabetes Academia 2020, he said those suffering from diabetes have an immunocompromised status which tends to reduce their resistance and make them more vulnerable to corona-like infections. Dr. Singh said that diabetologists have a special responsibility towards their patients in keeping their blood sugar level strictly under control to avoid infection and at the same time educating them about precautions to be exercised. The minister said most of the deaths occurred in India were among those corona-positive patients who were also suffering from comorbidities of chronic disorders like diabetes. Dr. Singh noted, even after COVID pandemic is over, the discipline of social distancing and avoiding droplet infection will act as a safeguard against many other infections as well. The Delhi government has started the plasma bank facilities for the treatment of COVID-19 patients. These facilities have been set up in the Institute of Liver and Biliary Sciences and Lok Nayak Hospital in Delhi. Talking exclusively to AIR News, head of the Department of Blood Bank at the Lok Nayak Hospital, Dr. Sunil Kumar said, plasma therapy helps in the recovery of corona patients.
प्लाज्मा थेरेपी कोविड पेशेंट के लिए बहुत ही यूजफुल है। जिनको कोरोना हो जाता है उनके शरीर में एंटीबॉडी बनता है जो उससे रिकवर कर जाते हैं और वो एंटीबॉडी का लेवल 1 महीने बाद सबसे उच्च स्तर पे जाता है और वो 3 महीने तक एक मिनिमम लेवल उसका मेंटेन रहता है। इस बीच में अगर वो प्लाज्मा को डोनेट करें और वैसे पेशेंट जो अभी पूरी तरह से सीवियर कैटेगरी में नहीं गए हैं यानी उनको अभी वेंटिलेटर की जरूरत नहीं पड़ी है, उस बीच में अगर उनको मॉडरेट कैटेगरी के पेशेंट को दिया जाए सेलेक्ट करके तो इससे बहुत ही सुंदर परिणाम देखने को मिलते हैं और पेशेंट काफी हद तक ठीक हो जाते हैं।
Our correspondent reports that the interested donors can call 1031 and can WhatsApp at the number 880000 7722 to donate their plasma. Afterwards, the doctors will get in touch with the interested donors and will confirm their eligibility. I'll repeat once again, the interested donors can call 1031 and can WhatsApp at the number 880000 7722 to donate their plasma. The plasma can be given only after the prescription of the doctors. Only those people can donate their plasma who recovered from coronavirus infection and completed the 14-day quarantine period. People between the age group of 18 to 60 years having weight above 50 kgs can donate their plasma for COVID-19 patients. Women who have given birth or persons with chronic health issues are not eligible to donate their plasma.
In our series, Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. S. Rajeshwari, Department of Anesthesiology, AIIMS, has advised the people to stay at homes and maintain hand hygiene.
We have seen that there is a severe shortage of ICU facilities in the most developed of countries. And in order that we do not face the same calamity in our country, it is vital that we do not stress the health system by becoming more sick and bringing more patients. And for this, I urge that you must stay at home and must maintain hand hygiene to reduce the number of patients coming into the hospital.
Dr. Purva Mathur, Professor Lab Medicines, AIIMS, has said that social distancing is very important to check the spread of virus.
Coronavirus spreads by droplets when a person coughs or sneezes. These droplets do not travel beyond 1 meter, and that is why it's important to maintain social distancing.
This is All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi addresses the United Nations Economic and Social Council session virtually a short while ago. Defence Minister Rajnath Singh says armed forces well prepared to protect country's self-respect and pride. The Health Ministry says COVID-19 fatality rate in the country is one of the lowest in the world. Central Board of Direct Taxes issues refunds worth more than 71,000 crore rupees during the pandemic. PM Swanidhi app launched to provide microcredit facility for street vendors at their doorsteps. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
सुनिए देश दुनिया एवं संस्कृत जगत की विभिन्न गतिविधियों पर आधारित आकाशवाणी का विशेष साप्ताहिक कार्यक्रम संस्कृत साप्ताहिकी प्रत्येक शनिवार प्रातः 7:10 से और पुनः प्रसारण रविवार प्रातः 7:10 से आकाशवाणी के FM समाचार चैनल पर।
The third edition of weekly news magazine Sanskrit Saptahiki will be broadcast at 7:10 a.m. on 18th of July on 24/7 FM news channels of All India Radio. It can be heard on 100.1 MHz frequency with a repeat broadcast on Sunday at the same time. The program will be live streamed on www.newsonair.com, News on AIR official YouTube channel, and can be accessed at AIR News Alerts on Twitter.
In Jammu and Kashmir, in view of the alarming spike being witnessed these days, the government has been seeking the support of people to follow SOPs and cooperate in preventing the further spread of COVID-19 infection. More from our Srinagar correspondent.
Chief Secretary B.V.R. Subramanian, while taking stock of efforts towards mitigating COVID-19 threat, has reiterated that perimeter control and complete lockdown in red and containment zones should be strictly enforced. Laying stress on the importance of early detection of infection, the Chief Secretary has directed the concerned officers for intensifying the efforts towards smart and targeted contact tracing by utilizing information from National Health Mission data, Swasthya Nidhi survey and Arogya Setu app. With regard to capacity enhancement of hospitals for accommodating higher number of symptomatic patients, he has directed that positive and asymptomatic patients be immediately shifted to COVID care centers, whereas only moderate and severely affected patients be admitted in COVID hospitals. This is Sunil Kaul for AIR News from Srinagar.
A total of 1,462 new confirmed cases of coronavirus were reported in Delhi during the last 24 hours, taking the total number of cases to 1,20,107. The Delhi government has confirmed that over 99,000 people affected with coronavirus have been cured so far. In the last 24 hours, 1,608 people have recovered and 26 deaths were reported in the national capital, taking the toll to 3,571. In Uttar Pradesh, around 1.75 lakh people have been identified with symptoms of cough, fever and breathing problem during the mass-level screening campaign conducted recently. Samples of around 40,000 such people are being tested now. The state government has also fixed the rates for treatment in private hospitals working as COVID hospitals. Samples of more than 52,000 people were tested yesterday, which is a record number of testing in a single day in the state so far. More from our correspondent.
Additional Chief Secretary Home Avnish Awasthi said that home quarantine is not allowed in state. For those asymptomatic patients who are interested in getting better facilities apart from the medical treatment, there is a new system in place in Ghaziabad and Lucknow districts. Such patients will be provided proper health treatment from government in the hotels which are acquired by administration, and they will be charged 2,000 rupees per day for double occupancy. This service will not be available for children and pregnant ladies. Unified command centers will be established at district level and also at state level for better coordination in surveillance, medical screening and ambulance system. Help of drones will be taken for surveillance in containment zones. Sushil Chandra Tiwari, AIR News, Lucknow.
In Gujarat, Chief Minister Vijay Rupani today inaugurated the newly set up 1,000-bedded hospital in Surat through video conferencing from Gandhinagar. Our correspondent reports that the new hospital has been set up within the short span of 15 days at the Surat Civil Hospital campus and will have 211 ICU beds. The Chief Minister said the new hospital will not only provide adequate beds but also offer modern treatment facilities to the COVID-19 patients. He said, with the addition of these beds, the total bed capacity in Surat will be more than 3,300. Mr. Rupani added that the government is focusing on microplanning, intensive surveillance and doorstep medical services such as Dhanvantri Rath to contain the spread of COVID-19 in the city. The 4-member central team, which is on visit to Gujarat today, appreciated the state government's efforts in bringing down the mortality rate to 1.5%. Addressing a press conference at Gandhinagar, Director of AIIMS Dr. Randeep Guleria said there is a remarkable change in the COVID-19 situation in the state. He appreciated various initiatives of the state government like Dhanvantri Rath, intensive surveillance, the participation of private doctors in COVID treatment, day-to-day monitoring through CM dashboard. Mr. Guleria said the urban health model adopted by Ahmedabad Municipal Corporation can be replicated in other cities. Earlier in Surat, Dr. Guleria said that the government will soon issue a policy to check the hoarding of tocilizumab injection in the country.
एक पॉलिसी बना रहे हैं जिससे इंजेक्शन की होर्डिंग ना हो, इंजेक्शन आराम से सबको मिल पाए और जिनको जरूरत है उनको ही मिले. कई दफा ऐसे होता है कि इंजेक्शन का मिसयूज भी ज्यादा होता है, तो उसको रोकने की भी जरूरत है कि जिन लोगों को एक्चुअली इंजेक्शन और दवाई की जरूरत है उन्हीं को मिले, जिनको नहीं है उसकी होर्डिंग ना करें और उसका गलत इस्तेमाल ना करें क्योंकि इंजेक्शन से नुकसान भी हो सकता है अगर दिया जाए जब उसकी जरूरत नहीं.
Maharashtra Home Minister Anil Deshmukh has appealed to citizens to observe the upcoming festival of Bakrid or Eid-ul-Adha in a symbolic fashion. Following a meeting with Chief Minister Uddhav Thackeray, the state has released guidelines for the festival. Details from our Mumbai correspondent.
Guidelines issued by Maharashtra government clearly state that no relaxation will be allowed in containment zones for the Eid-ul-Adha festival. The state has urged Muslim brethren to offer namaz inside the safety of their homes as religious places including masjid and Eidgahs continue to remain shut. The government has said that all livestock markets will remain closed and anyone who desires to perform the sacrifice ritual must do it through online mode. Meanwhile, 6 CISF personnel have donated their plasma at the Civic Run Naya Hospital in Mumbai. The personnel deployed at Mumbai airport had contracted the infection in line of duty. A CISF personnel, Sub-Inspector Anshuman Tiwari, who has donated his plasma, said he is happy that his gesture will save people's life. He added that no one should be averse to donating their plasma as it does not involve any risk. Nisha Rani, AIR News, Mumbai.
Karnataka Chief Minister B.S. Yediyurappa has said that lockdown is not a solution to contain COVID-19 and added that there is no proposal to extend the week-long lockdown in Bengaluru. He was speaking after holding a meeting with in-charge ministers of 8 Bengaluru Mahanagar Palika zones regarding COVID containment measures. He stressed upon zonal in-charge ministers to ensure hassle-free admission and treatment of COVID patients to hospitals or COVID care centres. He asked the officials to convert marriage halls and hotels into COVID care centres for asymptomatic COVID patients. The Chief Minister also said that decentralized bed allocation system at the zonal level should be closely monitored and ambulances should reach doorsteps of infected people within 2 hours of being tested positive. A report.
Total COVID cases in Karnataka stood at 3,693 and deaths at 115 in the last 24 hours. Total tests carried during this period were 24,700. The mortality rate increased to 2.5% and with 1,028 discharges today, the recovery rate stands at 37.66% in the state. As on now, total active cases in the state are 33,205. Bengaluru again contributes the major share of new COVID active cases. The city recorded 2,208 new COVID cases and 75 deaths. The mortality rate is at 2.04% and recovery rate is down to 22.88% in the city. Sudhindra, AIR News, Bengaluru.
Kerala continued to report a spike in COVID-19 cases as 791 new cases are confirmed today, out of which 532 are through local transmission. The state also reported one COVID death, taking the death toll to 38. More from our correspondent.
Thiruvananthapuram is the worst hit with 246 new cases, among which 237 persons got the disease through contact. Chief Minister Pinarayi Vijayan said that the situation is extremely serious, especially in Poonthura and Pulluvela areas where community spread is being confirmed. He said that complete lockdown will be declared in the coastal regions of the district in due course, for which the regions are divided into 3 zones. More health workers and police officials will be deputed there. COVID first-line treatment centers will be made functional in the region at the earliest. Public is strictly forbidden from venturing out except for emergency. Meanwhile, 133 recoveries were reported in the state today. Presently, 6,029 active COVID cases are there in Kerala. Mayusha for AR News from Thiruvananthapuram.
In Odisha, in the wake of rising COVID-19 cases, the state government has imposed complete lockdown in 4 districts from 9 p.m. tonight to midnight of 31st of July. The lockdown will be in force in Ganjam, Jajpur, Cuttack and Khordha districts and Rourkela Municipal Corporation in the Sundargarh district. However, essential services will be permitted, while some offices of central and state governments would be allowed to function during the lockdown.
Bihar Chief Minister Nitish Kumar today reviewed the situation of spike in number of positive cases of coronavirus in the state. Mr. Kumar appealed to people not to panic and said the recovery rate of the state is better than the national average. The Chief Minister said the target of 10,000 tests per day has been achieved and it should now be increased to 20,000. He said those going for home isolation should be given pamphlets during registration so that they know how to isolate themselves at home. Meanwhile, positive cases have mounted to 21,558. Altogether, 14,101 people have recovered from the infection so far. 7,289 patients are under treatment in various hospitals across the state. 180 people have lost their lives in the state so far. Over 3,47,000 tests have been conducted in different parts of the state. Recovery rate in the state stands at 65%. In Madhya Pradesh, the monsoon session of the State Assembly has been postponed due to the pandemic. The 5-day session was scheduled to begin here in Bhopal from 20th of July. More from a correspondent.
The Assembly officials informed that the decision to defer the session was taken unanimously at an all-party meeting today, chaired by Pro Tem Speaker Rameshwar Sharma. The meeting was attended by Chief Minister Shivraj Singh Chauhan, Leader of Opposition Kamal Nath and Home and Legislative Affairs Minister Narottam Mishra among others. The decision will be forwarded to Governor Anandiben Patel for approval. Meanwhile, the COVID-19 case count in the state crossed to 20,000 marks. The death toll in the state has also risen to 689. A total of 219 persons were discharged from hospitals yesterday, taking the number of the recovered cases to 14,127. Now the state has 5,565 active cases. Sanjeev Sharma, AIR News, Bhopal.
The Rajasthan High Court adjourned the hearing on the petition of Sachin Pilot and 18 other rebel Congress MLAs till 10 a.m. on Monday. The court also ordered the Speaker not to take any action on the notices issued to these MLAs till Tuesday. Congress rebel Sachin Pilot and other rebel MLAs of Congress have filed a petition seeking dismissal of the disqualification notices served to him and 18 other loyalist MLAs of his. Meanwhile, Special Operation Group SOG of Rajasthan Police has today registered 2 cases after some of audio clips went viral regarding allegedly trying to destabilize the government by offering money to the MLAs. Chief Whip Mahesh Joshi has filed complaints in this regard. More from our correspondent.
The political developments remain continued throughout the day from Jaipur to Delhi. Congress leader Randeep Surjewala made serious allegations on BJP in the morning over the audio clips that became viral. He alleged that the BJP is plotting to destabilize the state government. In the evening, senior leaders of the BJP held a joint press conference. State BJP President Satish Punia said that the Congress is blaming the BJP in their internal dispute. He said that it is defamatory to accuse the BJP leader in this matter and all options are open before the party. Leader of opposition Gulab Chand Kataria accused the state government of misusing government agencies. Jitendra Dwivedi, AIR News, Jaipur.
A mobile application of PM Street Vendors Atmanirbhar Nidhi, PM Swanidhi, was launched in New Delhi to bring microcredit facility for street vendors at their doorsteps. Secretary of Housing and Urban Affairs Ministry Durga Shankar Mishra said PM Swanidhi mobile app aims to provide user-friendly digital interface for lending institutions and their field functionaries for sourcing and processing loan applications of street vendors under the scheme. He said the app is a step towards boosting the use of digital technology and will enable field functionaries to ensure maximum coverage of the scheme. The ministry said that the launch of the mobile app will give impetus to the implementation strategy of the scheme, besides promoting paperless digital accessing of microcredit facilities by the street vendors. The app can be downloaded from the Google Play Store for use by the lending institutions and their field functionaries. It said since the commencement of the lending process under PM Swanidhi on 2nd of July, more than 1,54,000 street vendors have applied for working capital loan across states and union territories, out of which loans to over 48,000 street vendors have already been sanctioned. PM Swanidhi was launched by the government on 1st of June this year for providing affordable working capital loan to street vendors to resume their livelihoods that have been adversely affected due to COVID-19 lockdown.
Now let us take a look at the weather forecast for tomorrow. The national capital Delhi will have a generally cloudy sky with rain. It will have minimum temperature of around 28 degrees Celsius and maximum 36 degrees Celsius. Mumbai will have generally cloudy sky with moderate rain. The minimum temperature will be 26 and maximum temperature will be 29. Chennai will have generally cloudy sky with light rain. The temperature will hover between 25 and 33. Kolkata will have partly cloudy sky with possibility of moderate rain or thunder showers. The minimum temperature in the metropolis will be 28, while maximum will be 34 degrees. On the north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 26 in Jammu, while maximum will be 35. The city will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. In Srinagar, the minimum temperature will be 18, while maximum will be 33. The city will have mainly clear sky, becoming partly cloudy towards afternoon or evening. In Gilgit, the temperature will hover between 16 and 29. It will have mainly clear sky, becoming partly cloudy towards afternoon or evening. In Muzaffarabad, there will be mainly clear sky, becoming partly cloudy towards afternoon or evening. It will have minimum temperature of 22 degrees Celsius, while maximum temperature will be around 37 degrees.
Prime Minister Narendra Modi delivered the keynote address virtually at this year's high-level segment of the United Nations Economic and Social Council ECOSOC session today at the United Nations in New York. It was the first address by the Prime Minister to the broader UN membership since India's overwhelming election as a non-permanent member of the Security Council on 17th of June for the term 2021-22. The theme of the high-level segment of the ECOSOC this year is multilateralism after COVID-19. What kind of UN do we need at the 75th anniversary? Coinciding with the 75th anniversary of the founding of the UN, this theme also resonates with India's priority for its forthcoming membership of the UN Security Council. The Prime Minister reiterated India's call for a reformed multilateralism in a post-COVID-19 world, which reflects the realities of the contemporary world. Now we'll speak to Mr. Shekhar Iyer, political analyst, on Prime Minister's address at the United Nations Economic and Social Council session at 8:30 this evening. Mr. Iyer, the Prime Minister talked about the contribution of India's UN developmental work and shaping the ECOSOC agenda, including the Sustainable Development Goals. Can you please elaborate on this?
Well, the Prime Minister's address was in the context of the UN's 75th anniversary, which is being observed this year. And he was addressing the Economic and Social Council, which is one of the 6 principal organs of the UN body, which is concerned with the Sustainable Development Goals. So the Prime Minister particularly mentioned how India is moving forward in implementing these Sustainable Development Goals. And he also brought in context the kind of challenges that India has faced, whether it is a matter of housing, whether it is a matter of public sanitation, and also the recent challenge, or rather the ongoing challenge posed by the COVID-19. And he concluded his address with a call for reforming the UN system through multilateral approach. And a very significant point that the Prime Minister made today was the UN was born just after the Second World War because of the furies unleashed by the war. And similarly, there has been a fury which has been unleashed by this pandemic all over the world. People are very upset. People are very distressed. So the Prime Minister said, occasion for reforming a global system, bringing in the human-centric approach.
Yes, that's right. And in fact, Prime Minister also mentioned that our motto in our country is Sabka Saath, Sabka Vikas, Sabka Vishwas, meaning together for everyone's growth, with everyone's trust. And this resonates with the core SDG principle of leaving no one behind, especially in post-COVID-19 world, right?
Exactly, because when the Prime Minister has been talking about Sabka Saath, Sabka Vikas and Sabka Vishwas, which is also necessary for cooperation among the member nations of the United Nations. Because as the Prime Minister put it, that the core philosophy or the guiding principle is together for everyone's growth with everyone's trust. And today the UN body has to resonate with this trust because of the global challenges that have come. And particularly the Prime Minister said all the core principles that are involved in the sustainable development growth, particularly whether it is nutrition, whether it is health education, electricity or housing. The Government of India's approach has been that we do it by including the people and as far as possible making it a people's movement. So the Prime Minister was saying that India's own experience and India's own achievements and record can be good guiding principles for taking forward these SDG or the Sustainable Development Goals ahead by bringing about a complete change in the system, because there has been a lot of call for changing the UN system because it no longer reflects the way the developing world is facing the new challenges like the pandemic.
Yes, and Prime Minister has called for reformed multilateralism with a reformed United Nations at the centre. Mr. Iyer, in our fight against COVID-19, we have seen that our country's fatality rate is one of the lowest in the world. And the Prime Minister also said that our grassroots health system has helped India attain this feat. So it can be an example for the world.
Exactly, because the Prime Minister spoke of the kind of health infrastructure that we have developed over the years. And also, as soon as the outbreak of COVID-19, we saw the government getting into high gear of trying to create as much as possible, revamping the existing facilities to take care of this pandemic. So we have seen specifically designated COVID hospitals all over the country. We have seen even the private hospital resources have been called in for supporting the government's efforts. Also, we have seen how our health professionals have been working 24/7 without taking a break to meet this problem. So therefore, the Prime Minister said that the COVID-19 pandemic has tested the resilience of our, of course, it does of all the nations, but more of India, because given the kind of size, we have, and we have ensured that this fight against the pandemic is rather a people's movement. We have seen right from the Janta curfew, which was started, followed by lockdown, and given our size and so many cities, the way people have largely cooperated in enforcing the lockdown and also following all the measures, particularly wearing masks, keeping the 2 gaj ki duri or the social distancing, and also bearing the brunt of the economic burden, because a lot of economic activity has come to a standstill and is slowly picking up now. So the Prime Minister wanted to tell the global community, look, we have also, tackled this problem by announcing a special package. And he even said that we have our package, that is a package which has been called the Atmanirbhar package, which comes to about $300 billion. And he says this is the way, how to put the economy back on track. And we are using this opportunity to create a modern infrastructure. And we also want to ensure that all these changes are technology driven. So therefore the Prime Minister said, look, this is the way we are going forward in tackling the pandemic, and as well as tackling what the larger goal of sustainable peace and prosperity. And Prime Minister, that's why he said, look, we are doing it. We are trying. It is not just the government is engaged or a particular agency is engaged. Rather, it is being done at multi-level or multilateral level. That's why the Prime Minister said, look, in doing so, we are taking care of all issues, whether it is the issue of housing, whether it is the issue of financial capacity building, or whether it is a question of caring for the environment, because sustainable development goal also involves caring for the environment. You need development, but that has to be a sustained level.
Yes, Mr. Iyer, you very nicely have mentioned our Prime Minister's call for an Atmanirbhar Bharat and how people of our country have very faithfully and obediently, responded well to all the calls for social distancing and maintaining do gaj ki duri. Not talking about our planet, even Prime Minister also highlighted that while moving ahead for development, we don't have to forget our planet. And of course, he mentioned that we have to pay more attention for climate change in such a scenario because after all, these pandemic like COVID-19 are a result of climate change.
Yeah, because we have seen that, when we made that commitment at the Paris Climate Conference, we agreed to reduce 38 million tons of carbon emissions annually. It was a big commitment because considering that we are still in the stage of development, to make that kind of commitment, and since then we have seen a lot of steps have been taken, whether it is cutting down emissions from our power plants, or railways going completely on electric traction, or whether it is our airports turning green, or promoting the use of green fuel. These are the steps that we have taken at a cost, and the cost is because our people have to bear the burden of this technological change. Because after all, we have just seen how Bharat 6 has been now implemented. All the new vehicles that are being bought and sold in the country today have Bharat 6 emission norms, which is on par with the Europe norms. So therefore, we have made that commitment to reduce those emission norms, and we are doing it. And apart from that, we have also, going about electrifying our villages, providing clean cooking fuel, particularly the scheme of providing free cylinders to all the households, more than 80 million poor households. That was also part of reducing the emissions caused by using wood as a fuel for cooking. So the Prime Minister said, look, we have also set a target of 450 gigawatt of renewable energy, and we are also restoring the degraded land. And the idea is to restore about 26 million hectares. Now, these are big goals. These are very set targets. And apart from that, Prime Minister also spoke about the Solar Alliance, where we have joined with other countries which enjoy ample measure of sunlight. So we have gone about promoting, building up of solar cells, our own indigenous industries, so that, we create a kind of technology that is required to promote solar energy. This is also part of our commitment, and that is why India's role, particularly in this initiative for this International Solar Alliance, is actually a practical way of demonstrating how we are committed to action on climate.
Yes, and very quickly to sum up, would you also like to mention about India's role in the region as a first responder for ensuring medical supplies to different countries and for coordinating a joint response strategy among SAARC countries?
I think that was the most, I would say, the significant aspect of the Prime Minister's address, because as soon as the pandemic struck South Asia, we saw the Prime Minister taking the initiative of holding a discussion with all the SAARC leaders, and also making available a commitment of about $10 million, to provide whatever the facilities necessary. At the same time, we also sent, all these personal protection equipment, masks, and sanitizers, gloves, whatever we had, we started distributing. And you will also recall when it was felt that a particular drug could be, which was a great supply here. When America made a request and other countries made a request, which was considered probably the drug could help in containing the pandemic, India had no hesitation in sending these medical supplies all over the world. In fact, more than 24 countries got our supply. That goes to show that when it comes to even an issue like pandemic, normally in such a situation, there is a lot of pressure on the government to first take care of its own citizens. But at the same time, India being one of the founders of the United Nations, we also felt the global commitment that for us the world is the community. Yes, the Indians must be cared, but Indians must also play their role in, combating such a big challenge which the world has not seen in the past 100 years after the infamous Spanish flu.
Yes, Mr. Iyer. After all, the world is one family, and it is for us, as we say in India, Vasudhaiva Kutumbakam. Thank you, Mr. Iyer, for joining us in our evening news program.
Thank you.
And now, before we end, the headlines once again. Prime Minister Narendra Modi addresses the United Nations Economic and Social Council session virtually. Defence Minister Rajnath Singh says armed forces well prepared to protect country's self-respect and pride. Health Ministry says COVID-19 fatality rate in the country is one of the lowest in the world. Central Board of Direct Taxes issues refunds worth more than 71,000 crore rupees during the pandemic. And PM Swanidhi app launched to provide microcredit facility for street vendors at their doorsteps. And that is all in the evening news. Good night.